Okay, I come up to the patient. He has a major bleed from his arm. It's amputated. I'm going to grab this tourniquet. This one here is the cat tourniquet. If you see, I open it up. This is the red tab. I want to pull towards me. I put this as high as I can go because I don't know if there's more injuries. And then I'm going to pull this as tight as I can right here. This is critical. And then I'm going to stop right before I get to this part. Now I'm going to turn this. It doesn't matter what direction I turn. I turn until there's no more bleeding. I turn, and this is going to hurt, but I turn until there's no more bleeding. Then I secure it in this clip here. Take the excess strap around it like this. And then I take this white time strap and put it here, and I can write the time. You have 2 hours to leave this on before you have to do something else and exchange it to a different bandage. This patient has an amputated arm. We have to get a tourniquet on. We're going to use the SAM XT on this one. What you want to do is orient so you pull this gray tab towards you. So I go as high as I can on the arm, and now I'm going to pull this strap, and then you're going to hear a click. Pay attention to the click. That's the click that it locks in place. Now I'm going to turn this rod, it doesn't matter which direction, until there's no more bleeding from this arm. When that bright red blood stops, that means this is secure and it's tight enough. And now we finish it by putting it through this clamp here and then putting the gray time strap over it and writing the time. You have 2 hours to leave this in place before you change this to a different bandage. Okay, you found your patient. They're bleeding from an amputated leg. My helper is going to push here as tight as they can to slow down that bleeding. I'm now going to grab, this is a soft TW. Different style tourniquet than before. I'm going to now either align it so I can pull towards me, but I want to show you that if you can't lift that limb, you can take this buckle off. I'm now going to put that around the leg. I'm going to go high and tight like this. And this is where I pull tight as I can. And now I'm going to turn this rod here, as you can see, until there's no more bleeding from the leg. So I keep turning tight. And before I finish, I want to make sure that it's not stopping because of her pressure. So I'll have you remove your arms. There we go. The bleeding has stopped, and we secure it in place. On this tourniquet, you write the time right here, and you also have 2 hours with this before you need to convert this to a different type of bandage.
Question, why these three types of tourniquets?
Okay, so these are 3 of the most common tourniquets right now used in the United States and that are being shipped to Ukraine. I want to show you the difference. So this is the CAT Gen 7 tourniquet. Like the others, it has a windlass rod. It uses mainly Velcro here to go back on itself. And you can, again, all of these detach from the buckle. This one goes through this buckle, and then you secure it in place like this with the time strap on. This is the SAM XT. It has a metal buckle, similar concept. Difference is this buckle here has a device that locks in place. So if you pull it tight enough, it locks in, and the windlass rod again goes in like this. This is the soft T, little different buckle as well. It's a very light tourniquet, no Velcro, and again it locks in with this assistance clamp here and this triangle. All you have 2 hours with all these before any nerve damage takes place. So at the 2 hour mark, we do what's called tourniquet conversion, where we're going to convert that tourniquet to a wound packing or some kind of gauze or pressure wrap.
Okay.
Okay, this is the #1 mistake when using these tourniquets. So Tatiana's going to put pressure on it. You'll see this is arterial, how it's pulsating like that. Okay, now the mistake is people don't put it tight enough. So you see how it's loose here? Okay, now what happens is I turn it and keep turning it. And watch the blood. Go ahead, Tatiana. It's still bleeding. It doesn't stop it. So here's how you fix it. You have to put this on as tight as you can. Extremely tight. And then you start turning it. So watch. I'll turn it now about 3 to 4 times. And then I'll have you go another turn. We can do that too. There you go. Let's see if you can make that bleed.
No, it's nothing.
Not bleeding out. So remember to finish this correctly. It goes around here, and then with the white time strap, and you have 2 hours.
So super tight, so it's just squeezing hard.
Okay, I want to show you how to treat a junctional injury. This is where it's in the groin and tourniquet would not be able to go above it. So I want you to know how to do this. This is also for the armpits and the neck, and this is the groin. So you have an arterial bleed. As you can see, it's pulsating, you can tell. So how do I treat this? Well, I'm going to put that down for a second. Rip the QuikClot, and I'm going to pack this wound like we looked before. I'm going to make a little ball, and I'm going to put it in this wound as tight as I can. I'm leaving the rest of this gauze in my hand, and I'm getting deep in this cavity. This cavity goes in very deep. I got to push it in. I'm keeping at least one finger in all the time. So I go as high as I can, deep as I can with this. It's kind of tracking up towards the femoral artery and towards the middle of the body. So I pack this wound as tight as I can. This is again for the junctional areas, which is the groin, the armpit, and the neck. So now I have extra gauze. I'm going to leave it on top. And what do I do next? I'm going to grab a pressure bandage. I'm going to open the pressure bandage up, and I'm going to wrap this wound just to hold the gauze in place. I'm going to use this gauze. As you can see, it says other side to wound. So I'm going to put pressure on it like this. And now I'm going to wrap this wound to hold that in place. This is to hold all that gauze that we just packed in place. Finish it. It has Velcro on the back side, and now it's secure. And remember, this is when we cannot use a tourniquet because it's in the junctional area, meaning it's too high up here on the groin, it's in the armpit area, or on the neck. This is wound packing a junctional area.
Question. After you seal
Yeah.
and we take care of him, how do you put him to rest? If there is any specific position?
So that's called a recovery position. Once you're done treating it, I'm going to go treat another fellow, a citizen or casualty. I want to put them on their side, so if they vomit, they don't swallow that into their airway. So this side, the arm goes up, this leg goes up. I'm going to pull him, and as you would imagine, he's laying on his side with this arm actually supporting his head. This allows his airway to stay neutral and open. So if he does vomit, it doesn't go in his airway. And this is called the recovery position.
Got it.
Our casualty is saying that he can't breathe and he has difficulty breathing. So I check to see if there's any holes. I find a hole in his shirt. I lift up, and we'll say that this is a bullet hole. What we want to do is cover that up with a vented chest seal. This is the hyphen chest seal. As I open it up, I'm going to grab this red tab right here. Now there's a little piece of gauze, and that's so I can clean the area, and then I can identify the hole. We're going to say the hole is here. The trick to these is not just take it off because it's going to get stuck on your gloves, on your sweater. So you take it off halfway. See how I do it halfway? And then I'm using it like a Band-Aid. So I'm going to put this middle right over the hole, and then I continue the other part to take off like the Band-Aid. Now I want you to make note here. You see these 3 channels? These are the vented valves. As the patient breathes in, it will suck up. As the patient breathes out, air will come out of these vents. This is to allow air to release from the chest cavity and not come in while he's breathing. This is a very deadly injury to the torso and to the patient. So I'm going to start with, hey, can you hear me? Are you hurt? I'm using my hands and I'm checking his head for blood. I look no blood, then there's no wound. I now go to my chest area. So you can lift the shirt, and I'm using my fingers and I'm doing this. Because if there's a hole in here, my fingers will catch the hole and I'll be like, oh, there's a hole here. So I want to envision that there's a hole here. We have to close that hole. The way we do that is a chest seal. So let's pretend that this thing here is the hole from the bullet wound. I'm going to open this chest seal up like this. It opens up and there's another red tab. This white gauze is to clean the blood around the hole so I see the hole. Now here's how we put this on. We use like a Band-Aid. I go halfway, just like this. And you have sometimes with Band-Aids, if you put it all on, it gets stuck like it is now. So I'm going halfway like this. And then with the rest of it, I'm kind of sliding it on like that. And as you can see here, sometimes it does that. So So that's how we do it. So halfway and up. This has vents here. So as the patient's breathing out, air will come out of these vented channels.
There's little vents, huh?
And as he's breathing in, it will suck down to create that negative pressure. We don't want air to be in here. So I'm continuing to check. I'm raking. I'm looking for that major bleeding. I want to check the armpits.
Same in the back?
Absolutely. So I check the armpits, I check on this side. Now I want to check the back. The way I do that, I'm going to bend this knee like that. Take this arm, put it up here. I know it's pretending that it's amputated. And then I pull them towards me. Now I'm going to have them rest on my thighs so I don't have to hold them up. Now check the back. Again, I use my fingers because in the dark you may not see. And I'm raking, looking if there's any blood on my hands or if it catches a hole. If there's another hole, I do the same type of bandage where I put the vented chest seal halfway up and pull the rest.
Okay.
All right, I want to show you what do we do if we have a critical injury to the neck. We have to do two things here. We have to pack this wound, and I'll let you start kind of giving a little bit of blood so you get the realism. So we have to start packing this wound, and then we have to bandage it. So to start, I'm going to open my gauze. I'm going to calm my casualty down. Hey, stay in there. How you doing? What else is hurting you? All right, so now I'm going to push in deep to find where that wound is. And then I'm going to go as fast as I can to fill this cavity. And what I'm doing is I'm pushing this as fast as I can and as deep as I can into this cavity.
And finger after finger, don't let a finger out.
Exactly. Taryn's right. So we want to keep pushing this in and not taking any fingers out. So I'm pushing up, I'm pushing to the side, pushing to the other side, and getting as much of this gauze in there. Now this also has QuikClot kaolin product in it. So that means it helps the body clot using its own normal clotting system. And this takes about 1 to 3 minutes to take effect. And it works on patients that have bad clotting issues or great clotting issues, it doesn't matter. So I keep packing this in. As you can see, you can put a lot of gauze into this wound here. So I'll keep going as much as I can. If I ever get to the end and I can't put any more, then I'll keep the rest on top. So what I'm going to do now is, let's just say that this was right here, okay? So I'm going to move this out of the way. I'm going to keep pressure. I'm going to move this so you guys can see. And now it was right here. I have to wrap it. So I'm going to grab this gauze. I'm going to grab this pressure bandage, excuse me. And again, it says other side to wound. So we said that it was here. I'm going to do a gentle wrap like this. This is just to hold it in place. This is not to stop his circulation by any means. Now, I want to go pressure here to his armpit. So how do I do that? I'm going to push him this way. And now I'm going to take this. If I use this arm like that, it will go under it. And now I pull very tight because I'm pulling this, not this side. This is loose. Go tight under his armpit and back around his neck. Again, all the tightness is here, not here, so it's not cutting off circulation. I go back super tight. And now all the pressure is here. If he's unconscious, I'm just going to leave him in that position. I can take this arm up and I can leave him in this position. All the pressure is on his neck. He still has blood flow right here. You can see it's super loose.
Yeah.
This is how we pack and bandage the neck.
Excellent.
Okay, a common injury is not only to the neck and groin, but also to the armpit. So we check the wounds and we lift here and we find that there's a bullet hole right into the armpit right here. We check it, we have bleeding in our hand, we see it. We want to expose the rest of the chest to make sure. We can see we already put a chest seal earlier, but we maybe missed this armpit hole. So what do? We're going to take another pressure bandage, open it up, and this time, similar to how we did the neck where we went around, we're actually going to put pressure on here first. So I put direct pressure right over the wound, bring him towards me like this, and I'm going to reach under his neck, and I'm pulling really tight. Sometimes you can capture this shoulder right here, as you can see, but right now I'm just going kind of low on his neck and super tight over the injury site. I can actually leave him laying on my thighs like this, and again, I'm putting really a lot of pressure right here. And we'll let Tatiana here check how much pressure is on here in a second, if you approve of it.
It wraps around about 3 times.
Around 3 times, depending on the brand you have. This one does about 3 times. So pull right in here where the armpit is.
It's really tight.
Yeah, super tight.
And then as you see here, as far as the neck, because some people may be concerned, it is lower on the neck, so more of like the trapezius area. We don't want to go too high, and then even if we do put pressure on the neck, he still has his carotid on the left side.
Okay.
The reason we need blankets is for hypothermia. Hypothermia is one of the leading causes of death in trauma, and the reason is this. If I have lost blood and now I would lose my ability to make a blood clot because my temperature drops. So it's this vicious cycle where you lose blood, you get cold, you lose your ability to make a blood clot. These are a stopgap measure, meaning it will buy you time until you can get a bigger blanket on. This will just help slow it down. So we want to keep them warm. This isn't going to make them warmer, but it won't let them get any colder until you can get more blankets on them. So I open this up. We want to cover as much as we can. You may need to even cover the head as long as you can see them, because we lose a lot of heat from the head. And then we want to tuck these sides in. Every trauma kit that we're shipping, and you see people donate to Ukraine, they have these in them to help with that. This is very important, because imagine you stop the bleed, you fix the chest, but then you forget to put a blanket and they die because of hypothermia.
Wow. When do you need tourniquet and when do I not need tourniquet?
That's a great question. So I want you to think of it like this. If you say, wow, that's a lot of bleeding, and it keeps coming out fast, you have to use a tourniquet when it's on the arms and legs. Mm-hmm. But sometimes there's a really big cut and it's just slowly oozing out blood. Mm-hmm. There's no need to waste a tourniquet on that. We have pressure bandages and we have elastic wraps. Mm-hmm. So to show you the elastic wrap, let's say I put a little bit of gauze, you had some gauze in your kit, I put a little gauze, you were bleeding here. I'm going to, so you're bleeding right here. I see it just slowly coming out. I take an elastic wrap. This doesn't have necessarily a pad on it because you already put some gauze. But what it does have, you'll see, is the ability to keep it nice and tight, and you're not wasting a tourniquet on it. You can also use these if they have a broken bone and you want to put let's say a splint.
Keep it stable.
Keep it stable. So these elastic wraps do a lot in your kits on the battlefield. If you have a broken ankle or a wrist, you can use that. Now I want to show you the ending here is this bar. Yeah. This bar is to use to secure in place. But I also want to show you how you can use this in another configuration. Let's just say that you have a major bleed, but you don't have any more tourniquets. You take this bar,
becomes a tourniquet,
and you put it behind the last loop like that, and you start turning it. Does it feel like it's getting tighter?
Yes.
So obviously we would have gone really tight in the beginning. So this isn't an approved tourniquet, but it sure is better than nothing.
How does it hold on once you're done with it?
Exactly like that. Again, you put that little clip in here. It has teeth on it.
Okay.
I'll show you on this one too. And you can just hook that on.
And if you don't turn it into a tourniquet, how do you hook it at the end? Same way?
Same technique, but no need to twist it.
I see.
So this is the elastic wrap.
So wait, no, how do you show it? Can you show it?
Yeah.
No need to twist it?
Yeah, if you're doing the normal way, it was just like we were about to finish it.
It's got little teeth clips on each end to hook the edges.
So you put it under?
So you just go like that.
Oh, I see.
So the last one, let's see it. Just hook.
So just to complete it as a normal pressure wrap, you just do, even one teeth is enough. Because this isn't going anywhere. There's got teeth in here.
Okay.
If you're worried, you have a long ways to go, then you can do 2.
Excellent.
And why do I use this, not a pressure?
So this is for either you already wound packed, so you put the gauze in.
Okay.
If you don't need to pack the wound, it's just a big cut, you can use the pressure dressing. The way we use this is we open it up as well. This one here has a pad. And again, you would put other side to wound. So I put the pad down like this. Let's just show some blood there. And again, this is not squirting out because we would have done a tourniquet.
Yeah.
I now can pull this. You see these little Velcro tabs, so it doesn't allow it to unravel. And then we want to capture a large area. So we go a little bit above, a little bit below, and then we secure this in place at the end with the Velcro. And again, the difference between these two is that this is bulkier, this is not. This has a pad. It's a pressure dressing. It has a pad. And this is an elastic wrap. It doesn't have a pad. but you can use it if you already packed the wound.
If you like stuck.
So she broke her arm. This is the more that there's movement and instability, it hurts. And this is, not life-threatening, but it is very painful. So I just ripped a piece of cardboard here. I'll have you hold it here just for a second so I can open this. But the goal is to splint above and below. So if it's a wrist injury, we're going to go below the wrist and above the wrist. Some people also go up, and then we can put it in a splint. But what I'll do is I'm just going to remove your hand for a second. Just kind of bend this a little bit this way.
So just find some piece of cardboard.
Cardboard or a real splint would be ideal. But I'm just trying to make one here from the box we had on the floor. Kind of put your arm in there like that. If you can hold that for a second. Then I'm going to take my elastic wrap so you can see it has multiple ways to use it. Again, this one doesn't have that pad. So I'm going to wrap. And you can see that this allows us.
It gives you the stability to keep the arm from shifting the bones around.
Exactly. I do want to kind of always make sure that there's still circulation here. Sometimes the bones move and cut off circulation. So we check here and look that there's blood coming back.
How do you see it?
So what we do is if you look at her thumb here, I'm going to press on it. And you see how the color comes right back to it? So we call that capillary refill. If it comes back in under 2 seconds, you're good.
Okay.
Over 2 seconds, it's too slow. Unless, again, we have to deal with cold weather in Ukraine right now and snow, let's say. So it is going to be a little slower if you're outside. But this is a simple way to splint.
And how do you just kind of...
Yeah, so now we would take a triangle bandage and then you would just wrap that from your shoulders here to hold it in place.
What is a triangle bandage?
So a triangle bandage is a simple bandage that is in a triangle, and we put the point of
So
the
we
triangle
pull one of
here.
these off and do that?
Yeah.
Just reuse that one.
So if you wanted, again, to improvise and secure this to her, what I could do is I could just take one of these, grab the middle. I'm going to do a lark's foot, so I take the loop like this. I grab that like that through. And I'm trying not to move her arm, right? And you would be holding it with your other to help, of course. I can kind of spread the load like this. And now I can go around her neck. And I can secure these like that. I can do a knot, or I can just hook it in. I don't want to grab her hair, but you can see that that kind of holds it in place.
That's great. That's great.
So when it comes to splinting, Tatiana was asking, how do we splint bones and legs? So just remember the concept are simple. You always find the joint. If the joint is the one that's injured, we splint above and below. So if it's the elbow, you would splint all the way here and then below it, and then we would secure it to the body. If it's in the femur area, we're going to put a bigger cardboard, a bigger piece of splint that we can secure that leg, and we're going to keep them flat. So you always want to go above and below the joints.
Thank you for staying up last night with your family making those kits for us.
Thank you so much.
It's our pleasure, and we're really praying for your family and doing our best to help. I want to show you, for your family, for others that are receiving kits like this, what it's all about. So this is what is a traditional trauma kit. The way it works is you will clip this to your bag or a piece of equipment. It's MOLLE. When you need it, you unbuckle it, and then it rips away, so you don't have to have the whole bag next to you. You can put extra tourniquets on the outside, and the kits that you guys have are considered our advanced kit, and it has the following. You have 2 sets of gloves, so I'll show you those here. In addition to that, you have your tourniquet. This is the cat tourniquet that we reviewed in our training. That's in here. You have the elastic wrap that you can use to secure a limb, or once you've wrapped or packed the wound with a QuikClot, you can wrap it with the elastic wrap so you don't waste a pressure bandage. It also has, of course, the pressure bandage that we reviewed. So it has that as well. That's the one with the pad. It has these trauma shears that will help remove clothing from around the wound to expose it. So it has those. It has the hypothermia blanket that we talked about. It has duct tape to secure things like a cardboard splint or something that you need to secure in place. And then last, it has 2 of those vented chest seal. So there's one in each side for like an entrance and an exit wound. And if you don't remember all the stuff we talked about, this is our mnemonic, and this is the algorithm of how you can save a life. So you first stop the bleed, open their airway by putting him on their side, use those vented chest seals, and prevent exposure to the cold.
That's awesome.
So this is the card that it's in your kit to remind them.
Excellent kit.
That is awesome. Thank you so much.
Of course.
That is so great.
Fantastic.
Wow. This is gonna be for my friends and family and for all the innocent people that you guys thank you TraumaPack for doing that. This is great.
So awesome. Thank you, TraumaPack.